Alright everyone, it's Dr. Rahman here with the Dr. SR Clinic, and if you click through this video, that means you probably clicked via a link on a QR code, which means that you're interested in the hair treatments that we offer, and I'm delighted to explain a little bit about what we do and what is available to us, because the world of hair treatments and hair restoration has moved on leaps and bounds. From the olden days, when all we had to offer was transplants. We don't do transplants in our clinic, although I do refer some of my patients across to some of my esteemed surgical colleagues. But here at our clinic, we're more in terms of what we can do in terms of hair rejuvenation, improvement and restoration in a non-surgical term. So in my background, I've been in aesthetics for a good 11 years now. Hair treatments are very much kind of my kind of field of interest, and as much as I've done several lectures in conferences both in the UK and abroad, specifically on the subject of men and women's hair restoration, and also I was a finalist at the Monaco Aesthetic Medicine World Congress 2024. So a lot of the work that we do is based upon how to improve hair and to make sure that we reduce the loss of it, because it affects everybody to an extent, and as we get older it affects us more. Clearly the genetics are involved in it more than anything else, but there may be other factors in there as well. So as I was saying, in the olden days, transplant was really the only option, where you took hair grafts from one place and put it onto the head. But the problem with that, of course, is that there's only so many times that you can do that, and the old transplant methods used to be not very effective. You could lose and damage a lot of grafts along the way, so it wouldn't be terribly successful, and a lot of them look very sort of fake and artificial early on. Like I say, they're much better now, but it is a very expensive way of doing things, so we consider that kind of last resort. So what can we use over the counter? Well, a lot of things that you can buy which claim to be hair improvement treatments aren't particularly very good. Minoxidil or Regain was one of the first real genuine treatments on the market. It's available in droplets or in a shampoo or in a mousse, kind of a bit like a shaving formula. It's applied on twice a day. It takes about 3 to 4 months to work. It has been shown to be effective in getting some of in reducing hair loss and improving some of the hair follicles, but it's, like I say, 2 to 4 months to work. When you stop using it, any gains that you've seen will be lost as well. And it's sticky and it's messy, and particularly for women, not necessarily the best option, because it affects how the hair looks, and most women don't like to use sticky products, especially if they have long hair. So the next step up from that is tablets, for which Propecia or finasteride is probably the most common. We use dutasteride in our clinic a lot. In tablet formation, it takes about 6 months for that to work extremely well. We don't give it to premenopausal women, or indeed to men who are still likely to be wanting to start a family or plan to have more children. You can get versions of that now in the topicals, and at our clinic we can prescribe minoxidil and finasteride built into a liquid formulation, which can be applied directly onto the scalp, which is much safer. Then we get on to the injectables. This is where things get really interesting, because what we've been doing in previous years is taking your own blood and extracting the platelets from it in something called platelet-rich plasma or PRP formulation, and then injecting that back into the scalp to help rejuvenate and refresh the hair. This is by increasing the blood flow to the hair and improving the sites where the grafts, so where the hair follicles are sitting. Now, in even more recent years, we've been able to extract stem cells, and indeed the products of the stem cells themselves, and inject those back into the hair. So no blood needs to be taken for that. We get these from off the shelf, as it were, and they are mixed in clinic and injected straight in. This is called exosome treatment, and this is proven to be incredibly useful in terms of hair rejuvenation and rebuilding of hair follicles. It takes about 6 months to work again, maybe a little bit quicker the younger you are, and has proved to be very effective. in terms of rejuvenating the hair. We usually do that as a course of 3 or 4 treatments, and then we repeat those maybe sort of 1 or 2 treatments a year ongoing from that, depending on, again, sort of age and what other factors that may be affecting your hair. And we'll also use products in between. For example, we have a rollerball treatment for a product that applies directly onto the scalp. You use that twice a day after these treatments. There's special shampoos that can be used. Again, over-the-counter ones haven't been proven to be particularly useful, but we have very specialist shampoos which are designed especially for the purpose of helping the hair. Biotin may be useful. It's been shown in some studies that it's not terribly useful. Caffeinated shampoos may be of some help. So that's a whistle-stop tour of the kind of treatments that we do in terms of hair treatment, and hopefully some of those options might be useful to you and something that might be interested. So if you're thinking about hair rejuvenation and improving your hair thickness and hair quality, then links are down below. Please book in with us, and we look forward to seeing you at the clinic very soon.